are too busy and they don't have time to attend the patients, especially phone calls.
I would love to be.
Thank you. And doctor, one thing I would like to ask you, especially खुबशा बायलां खातीर हांव प्रश्न विचारता, स्पेशली जी बायलां मेनोपॉज जातात म्हणजे तांची पाळी बंद जाता. सी आय एम टॉकिंग अबाउट द पोस्ट मेनोपॉजल फिमेल्स. What type of diet or do you recommend calcium supplement for these females? Because often they say that they must take at least one calcium tablet. Then in that case, I would like to know for how long, what type of tablet, what should their strength, and how long at a stretch they should take, or they should take some break. Because some people say you should take 15 days gap and in between. What are your guidelines you would like to do?
See, postmenopausal osteoporosis is a very common problem worldwide, and it is probably one of the most neglected problems worldwide as well. Now, if you do have postmenopausal osteoporosis, the only way we can say you have osteoporosis is if we do a scan called as a DEXA scan, which tells us how weak your bones are in comparison to somebody else's of your own age.
I see.
Or of somebody normal of your own age. Now, if we know and it is documented that you have more than a certain degree of weakness compared to somebody normal, then you need to go on treatment. Now, this treatment includes calcium, includes vitamin D, but it also includes a certain stronger medicines called as bisphosphonates, which don't let the blood take calcium from the bones. Okay, it does not let the blood take calcium from the bones. So you give calcium and you don't let the bones get weakened by giving the calcium away.
So it is like stored in the bones.
It is, it does not go away from the bones, so your bones remain strong. And then there are newer treatments in the form of teriparatide, which is a hormonal preparation that is now being used. There are specific indications for each of them. Do not neglect your osteoporosis. Calcium it's a good idea to be taking calcium. How long? There is no correct answer to that. The correct answer is get a BMD scan done, know where you stand, and then decide whether you're osteopenic or osteoporosis and go on the correct treatment.
Sir, I think we have received one question. Hello.
Hello.
Yeah.
बिजोल चंद कालीला शिंदे उलयता.
विचारात बिजोल चंद.
हा दोतोर तुमकां एक सांग म्हाका कोंकणीन उलयता तुमकां इंग्लिशीन
ना नो प्रॉब्लेम तुम्ही विचारात. माझ्या जितकं शक्य तितकं हांव प्रयत्न करून तुमचो प्रश्न ट्रान्सलेट करता.
अच्छा म्हाका मातशें म्हाजे पांयाचो प्रॉब्लेम हांव झाडा वचून पडलों कित्याक मातसो तेन्ना म्हाजे दोनी पांय म्हणजे वाटयान म्हाका कटकट करून आवाज येता तेन्ना की हांवें म्हाजे वखदां चालू आहा पण तीच म्हाका कांय चड इफेक्ट येवंक ना. मातसो चलताना मातसो हें जाता म्हाका.
नाही म्हणजे खंय डॉक्टराकडे काय सकयल
धपरा वाटयांनी.
अच्छा. नाही फक्त कटकट आवाज येता होच तुमचो प्रॉब्लेम काय तुका दुखता चलताना त्रास जाता तशें?
ना मातशें दुखता मातसो पण कटकट आवाज येता चड करून आवाज येता आनी फाटल्यान भुजाचें म्हणजे हे सुट्टलें हाड म्हणजे ते बसयलेलें पण तितून मातशें म्हाका छातये कडेन दुखता उजव्यान.
अच्छा बरें सर. ओके. This gentleman is from my hometown Bicholim. What is important, he has fallen from a tree and since then he is having a pain in both the legs, both the knees to be most precise, and it makes a cut sound. That sound, I think that is also disturbing him perhaps, and he has some pain in the shoulder. What he wants to know about this, how this joint of the knee joint can be managed, I mean pain in the knee joints.
Right. I think a sound in the knee and pain in the knee are two different entities altogether. If he is primarily troubled by the sound, he probably has a bit of arthritis in the joint. I don't think it is directly related to the fall, but many people do correlate a fall or an injury or a trauma to the onset of their symptoms. As long as it is not overtly painful, overtly disturbing, I would tend to ignore it if it is not interfering with my activities of daily living. Having said that, if it is interfering, I think he needs an investigation. He needs to be worked up. We will have to do a basic X-ray to see what it is, and clinically examine him to see where that sound is coming from and whether that sound is painful, painless, whether there is an associated injury, a ligamentous instability or anything that is going with the knee.
कैलास बाब, हे तुमच्या प्रश्न जाप आशिल्ली की तुमकां थोडेशें वर्कअप करचें पडटलें, एक्सरे करचो पडटलो आणि मागीर तुमचे म्हणजे क्लिनिकल असेसमेंट म्हणजे तुमकां चलताना कितपत दुखता, कितें केल्यार दुखता, बँड जाल्यार दुखता किंवा चलताना दुखता आणि आवाजा बरोबर तुमची दूख आसा काय आवाज केन्ना येता आणि दूख वेगळ्या टायमार जाता, अशा तरेचे सगळे इव्हॅल्युएशन, क्लिनिकल इव्हॅल्युएशन करून तुमकां वखदपणे दिवं येता. सो डॉक्टरांचो सल्लो म्हजोय तुमकां सल्लो आसा तुमी डॉक्टराक मेळा आनी योग्य तो सल्लो घेयात आनी मार्गदर्शनान बेगीन बरे जायात. आय थिंक वी हॅव रिसीव्ड वन कॉल. हॅलो.
हॅलो.
या.
हांव माया कामत उलयतां दोतोर मडगांवच्यान.
मायाबाई विचार.
म्हजी न्ही आजी आसा.
हय.
तिजी एज 70 आसा आनी तिजो वेटूय म्हाका दिसता 65 एबाव आसा. तिजी नी प्रॉब्लम आसा, तिका खूब त्रास जाता. ती एक्चुअली सबन बरी आसा पूण पांया खातीर ती चलूंक शकना. दोतोरान तिका सांगलें की उदक भरलां वाटयांनी. तेन्ना तिणें 2दा उदक काडलें बी पूण तरी आतां तिका सामकें चलूंकूच येना, ती बसूनूच आसता. ताका आनी कितें उपाय आसा?
म्हाका सांगा तो जॉयंट जो सुजता आतां सुद्दां सुजिल्लो आसा?
सुजूना.
सूज कांयच ना?
सूज काय ना पूण तिका ती दुखता. ती आंगानूच पयलीं पासून मोठी आसा. सुजल्या आसा तें आमकां म्हाका दिसना अशें सुजलां अशें.
अच्छा.
आनी दुसरो प्रश्न म्हजो आसा दोतोर की आतां आमी बोटां मोडटा पळय टक टक करून ते एक्चुअली कितें एक्चुअली भितर आमकां हाडां मोडटात ती टक टक आवाज येता ते.
अच्छा. ओके ओके.
कित्याक आमी बोटां आमकां दुखता पूण कितें जाता एक्चुअली?
कळ्ळें. आज तुमच्या वतीन हांवूय हो प्रश्न तांकां डॉक्टरांक विचारता. ओके चलो थँक्यू वेरी मच.
मोडटा मागीर आमकां दुखना पळय.
कळ्ळें. ओके थँक्यू.
ओके थँक्यू डॉक्टर.
या ओके. Maya wanted to know her grandmother is sick in the sense she is having pain in both the knees. Doctor said there is accumulation of fluid. On 2 occasions the fluid has been aspirated. She felt better, but now again she is almost she cannot move. Otherwise she is healthy. She is around 70-year-old, 65, maybe more than 65 kg because she is little obese according to her. This was her one question. Second question is when you do like this, you make this sound. How this sound is generated and what is the physiology and whether it is good or bad to do this type of activities.
Right. Okay. So we'll go with the first question.
Yes, definitely.
I would love to. Okay. Right. See, the water accumulation in the knee is as a result of inflammation, which is what you have is a layer around the knee, which is called as the synovium. Once the synovium gets irritated, it starts producing fluid as a defense mechanism. And this fluid accumulates. Once the knee is full of fluid, your bending will become more difficult because there is only limited space within the joint. Essentially, it indicates that there is a problem, which can be identified by putting a needle in, aspirating the fluid and sending it to the lab, doing an arthroscopy or a number of other factors. But since her age is 65 plus, 70, roughly about 70, the most common cause is going to be arthritis, which does not warrant any other investigations other than an X-ray to make sure that there is arthritis, which is our first provisional diagnosis. And the treatment would be as for any other arthritis, painkillers, anti-inflammatories, exercises to start with, injections probably into the joint, and if nothing is helping, then the surgical option, which is the entire spectrum, which would again depend on results of clinical examination, the extent of her symptoms and other factors that we discussed.
One more question she was asking about
the second one.
In short, you answered because another person is online.
In short, the answer is I am not entirely sure, and I guess nobody is. But we believe that it is snapping of the tendons. There are small fibers, small tendons that run across the joints. They snap from one place to the other, creating that kind of a sound. But as I said, as I admitted earlier, I am not entirely sure.
Okay, doctor. Thank you very much. We are online. Hello. Hello.
Hello.
Yeah.
Hello.
Yeah, Vicharat.
I'm speaking from Ponda.
Yeah.
My name is Nitthi Khanolkar. Actually, my mother has got some arthritis, and the doctor has told that the knee replacement should be done.
Yeah.
But doctor, we have some other doctor has suggested that to put that belts. We have put belts to her legs now, but she is feeling better, but not much better. So any other alternative is there, doctor, to cure her
just tell me where exactly?
A brace, I guess.
Yes, doctor.
No, where bed you are using for the waist, for the knee, which joint?
For the knee.
I'll answer.
Both the knees.
Yeah.
See, arthritis essentially means that the space or the cushion or the cartilage between the top bone or the femur and the bottom bone or the tibia is completely gone. When she is walking, the top bone is rubbing on the bottom bone, which is creating pain. Now once you are having this and you put a belt or a brace from the outside, there are many kinds of braces that come, ranging from 500 rupees in the market to about 30,000, 35,000 rupees in the market, with different proposed mechanisms of action. The only ones that have shown to be slightly helpful are the ones that bypass your entire body weight. They are fit on the thigh, fit on the leg, they bypass your weight they bypass the knee. That is their proposed mechanism of action. But as is understandable, if you tie something tightly around your thigh and tightly around your leg, it is going to be very cumbersome, very difficult to use, and it is not always perfectly fitting for it to work. If she has got that bad arthritis, then the best solution for a problem is to have a joint replacement done. It is the most successful orthopedic surgery in general, and it gives excellent results. It takes the pain away, gives your mobility back.
I think her question is definitely answered. We are in touch with another gentleman. Hello.
Hello.
Yeah.
Yes.
विचारात प्रश्न विचारात.
Hello, doctor.
Yeah.
Hello.
Wow, rheumatoid arthritis.
Yeah.
And 8 months treatment घेता वोकाडा.
Yeah.
So treatment बरा पळान कितले ते म्हूण घेवपा तें.
बाय म्हाका दिसता दोतोराक वचून मेळ्ळ्यार बरें आशिल्लें. In fact, this patient is under your treatment. She has rheumatoid arthritis. You are treating her. She is feeling happy. She wants to know that for how long she should continue with the treatment.
I'm doing with Dr. Gatani.
Okay.
Okay.
Yeah.
Anyway.
See, if you have rheumatoid arthritis, it is a kind of an autoimmune disease where your own body cells start attacking your own joints. We have to continue it for a very long time, often for many years altogether. The only thing we do is we keep reducing the dose as your symptoms are come down. The medicines that would be given to you by Dr. Atul Gatani will be methotrexate, sulfasalazine, HCQS. All these medicines have potential. They are excellent medicines. They give you relief. They keep the disease under control. Yet they cannot be continued in high doses for a long time because they have the potential of harming the liver, harming the kidney, harming the blood. But as long as we can keep the doses down, keep monitoring your LFTs, your kidney function tests, and if everything stays under control, we can safely continue them. Our priority is to give you medicines so that your joints do not get permanently damaged and need something else.
I think, doctor, it's time up almost. I must thank you because for the first time that I felt that I'm sitting with a superstar, means like Amitabh Bachchan and all from the film star, because not only your name is related to Rajesh Khanna and other actors, but I'm also equally pleased by the personality and your friendly approach. I must thank you on behalf of all our viewers. Definitely, I'm sure that a lot of questions would have come, but we started a little late. So next time we would like to see you again for some other occasion, and definitely our people as well as myself will enjoy talking to you. सगळ्यांनी ही कार्यावळ थोडंसं लेट सुरू जाल्यान सुद्धा तुमच्या सहवासान आणि तुमच्या संपर्कांतल्यान ही कार्यावळ रंगतदार जाली. ही कार्यावळ कांय कारणांक लागून फक्त अर्द्या वरानच आज सोंपयता. दुसरे फावटी आमचे बरोबर आसतले डॉक्टर सीताराम कोरगांवकर, जे पेन मॅनेजमेंट म्हणजे दुखीचे म्हणजे शरीराच्या वेगवेगळ्या भागांत जे दूख आसा ताचे विशीं तुमचे प्रश्न आसतले ते तुमी आमकां मुजरत विचारात. तुम्ही कार्यावळी खातीर धीर धरून रावल्यात ह्या खातीर तुमकां काळजांसान सगळ्यांक देव बरें करूं. आयची कार्यावळ सोंपयतना परतून एकदां सगळ्यांक देव बरें करूं.